Attention Deficit and Hyperactivity Disorder, ADHD, is a neurodevelopmental disorder that affects millions of children and adults worldwide. It's characterized by symptoms of inattention, hyperactivity, and impulsivity that can interfere with daily life. Understanding exactly what ADHD is can help individuals recognize if they have the condition and how to seek help. The primary symptoms of ADHD include inattention, hyperactivity, and impulsivity. Inattention symptoms include difficulty staying focused on a task, forgetfulness, and poor organizational skills. Hyperactivity symptoms include fidgeting, restlessness, and difficulty sitting still. Impulsivity symptoms include interrupting others, acting without thinking, and difficulty waiting for one's turn. It's important to note that not all individuals with ADHD have all three symptoms, and the symptoms can vary from person to person. Some individuals may have primarily inattentive symptoms, while others may have primarily hyperactive impulsive symptoms. Additionally, it's also important to note that having occasional attention difficulties or hyperactivity doesn't necessarily mean someone has ADHD. For a diagnosis, these symptoms must be recurrent, persistent, and cause significant impairment in social, occupational, or other areas of functioning. ADHD is a neurodevelopmental disorder, which means that it's caused by changes in the brain's structure and function. Research has shown that ADHD is associated with changes in the brain's dopamine and norepinephrine systems, which are involved in regulating attention, motivation, and reward. It's also believed to be associated with genetic factors, as ADHD tends to run in families. ADHD is a chronic condition that can affect a person's daily life, relationships, and the ability to work or study. People with ADHD may have difficulty staying focused, finishing tasks, and following instructions. They may also have difficulty with time management, organization, and may have trouble with impulsivity, which can lead to problems with impulsivity and decision-making. The good news is that ADHD is treatable. Treatment for ADHD typically includes a combination of medications such as stimulants and behavioral therapy. Medications, such as stimulants, can improve attention and reduce impulsivity and hyperactivity. Behavioral therapy can help individuals develop strategies for managing their symptoms and improving their daily functioning. Additionally, there are also other interventions like mindfulness practices, neurofeedback, and occupational therapy that have found to be effective in treating ADHD. Thanks for watching. If you enjoyed this video, be sure to give it a thumbs up and subscribe to our channel.